I don't want to do it for mine.
Yo, what's
know,
up?
I know.
This
Yeah,
is
exactly.
Dex,
Hey,
the Demodex,
buddy.
coming live from my desk and not the eyelid.
Oh my god.
All right, throwing it back to you, baby J.
This is really funny. Good morning, YouTube world. My name is Joshua Coates, and your overnight success story, and this is the Baby J Show. Today, can you put camera on Dr. Z? We don't have the thingamajigger already set up right now for that. Otherwise, I would have Danae do it. Dr. Z, Dr. Zagelbaum.
Yes.
I call him Andrew.
Yep.
I was gonna make a stupid joke like I call him Drew and I really don't. I'm really excited to be talking to you today
Yeah, excited to be here.
on the Baby J Show.
Oh yeah.
Okay, so first off, here, bring the mic up just a little bit so that way it's like pointing to your mouth. No, there
gotcha.
you go. Yeah,
Better?
yeah. Okay. Where do I start? Okay, so I know that we're I don't want to say we're like crunched on time, but like I don't want this to go like too long.
Mhm.
So let's start with this. I just want to say, and I do want you to tell the audience what you do, what you're like really freaking good at. But from a real life perspective of a person, I don't know. You are the most down to earth doctor I have ever met.
I appreciate that.
And it is really nice. I don't know how to say it. It's like if I was your patient, which I guess I was once, like for a slight second or whatever. It's really nice to be able to talk to somebody who's able to describe and explain what is actually happening, and not just putting a whole bunch of filler scientific words
Yeah.
and pissing people off.
Yeah.
So I'm gonna shut up for a second. Look at the camera, please tell them, or look at me. I don't care. You look at me, look at the camera, look at the camera, look at me. Tell me,
Yeah.
who are you and what you do? What do you
Yeah.
do?
So, hey everyone, my name is Dr. Andrew Zagelbaum. I currently own and run the Dry Eye Center of Arizona. It's in Scottsdale, Arizona. My story is I moved out here from the East Coast about 2 years ago or so. And really, I got this whole process of working within dry eye started this story started probably about 3 years ago when I was a student. I worked with my mentor. His name was Dr. Art Epstein.
You can look at me now. You don't have to look at them.
Yeah, sorry, guys.
No, it's fine. It's fine.
So I worked with this guy, Dr. Art Epstein. That's where I met Danae. That's
I
when
actually
first
just
met you.
I forgot that until you just brought that up. That like
Yeah.
you were the student.
I was a student. Yeah, I was a
okay.
student for a while. And that was while I was in school. And that's how I got started in dry eye. And he really kind of opened my eyes to everything that could be done
Opened
with
my
dry
eyes.
eye. I know I did that on purpose. Thank you.
Did you?
I'm working on my type 5 over here. So
stupid.
all that being said, he kind of got my pathway started into dry eye. Really fell in love with the field.
No, hold on. Dry eye.
Go ahead.
Okay.
Yeah.
Average people. I don't
Yes.
say average people because I guess most people aren't like me where I like have 20 and a half vision. Most people do have eye problems and glasses and all stuff like that. So what is dry eye?
Yeah. So let's talk about that. When it comes to dry eye, I could sit here for hours talking about different presentations of dry eye.
Let's.
But to kind of simplify it down a little bit, we have a tear film that sits on the surface of our eyes. It's why our eyes always look wet. And there could be some instability there for a number of different reasons. And so when that instability comes about, that's what causes some symptoms of dry eye. I'll let you in on a little secret. Some people don't even like the phrase dry eye because it could be counterintuitive sometimes. One of the number one symptoms.
Hold on. What does that even mean? It's
So
counterintuitive.
Yeah, let's talk about that. One of the number one symptoms of dry eye is my eyes water too much.
Yeah.
And when you think about that, that's a little contradictory.
Oh,
there.
yeah. 100%.
It's, how can my eyes be dry if they're watering all the time? And it's not about dryness in the sense that we think about it. And that's why some people are trying to move away from the phrase dry eye and more towards ocular,
Leaky eye?
not quite leaky eyes, but more so ocular surface disease, because there's just so many different angles it can come from.
OSD?
Oh, yeah.
Is that what they're going to call it? Is
Yeah.
that basically? Okay.
Yeah,
keep
that's the
going.
lingo.
Okay.
So there's so many different things that can cause it. I mean, the main kind of way to break it down is when it comes to our tear film that sits on our eyes, there's different layers to it. And there's a mucus layer, a water layer, and an oil layer. And the way the mucus layer works is it's what causes our tears to stick to our eyes. That's pretty much it. the water is what we all think about. It's the water. And the oil is what protects the water.
Okay.
That's the simplified version of it. And the most common thing that causes it is some people have trouble with the production of the oil on the tear film. So that's the most common cause. But like I said, there are hundreds, if not thousands, of different causes for dry eye in general. So,
Okay. Pause real quick.
go ahead.
So we're gonna have to go all the way back because
Let's do it.
Yeah. So first, before we do this, we are sponsored by
Yeah.
Hunu, and I told Dr. Z here that he was not allowed to try it before we got on camera. So he's going to give the honest. Don't open it yet. He's going to give his honest reaction before. I mean, this is all they wanted me to say. Braben and Dayton have created a healthy soda, and they just wanted me to say it's soda that's good for you. All right, let's open it.
Fair enough. Do you ever do like the ASMR, like open it into the mic?
Yeah, oh, that was much better than
That
mine.
was crispy.
That was great.
Love that.
That was like a 7.2.
Oh, it's pretty good actually. Fun fact:
Yes.
cherry lime is my favorite flavor. of
Is it
things.
really?
Yeah, I'm a big cherry lime guy.
Oh shit.
It's
Okay.
good.
Okay, so I'm just going to continue as what is this, episode 5 for the Baby J show? I'm just going to continue drinking this the entire time, so please don't mind me. Now, actually, two things. I want to do two things. First, and if Danae would like to come up here, why? I want to ask, even though it's just a rhetorical question. Why is this the Baby J show? So if Danae wants to pop in here, or if you want to, I don't care. I can say it, but basically, girlfriend Danae, and she can pop up as the Demodex. We'll get into that later. Can you? That's her. As a term of endearment, it was very cute, and I loved it. And then she shared it with you. She is what is she what is her role?
Yeah. So Danae is my technician, which means she's more or less my right hand person at the office. When I show up to work every day, I go in, make sure my patients are doing well. I treat them, I diagnose them. Everything else, more or less, that has to do with making sure that office stays afloat, Danae takes care of. So that's really where she comes into play. And she was actually at the office when I was there as a student. And so I went from being kind of like her student to her boss, which is awesome. But
Crazy.
she's basically the person who puts out any fire that comes up for me in my day-to-day job.
She is freaking awesome. Thank you, Danae, or Demodex Danae, and we'll get to that later. Now, let's go back. Where are you from?
I grew up in Long Island, New York, a town called Jericho. Spent most of my life in the Northeast, and then did my undergrad in Manhattan, did my training in Boston.
Correct me if I'm wrong, but your father is also an eye specialist.
Yeah, so my father is an ophthalmologist, and a lot of people get confused about the difference, optometry versus ophthalmology.
Yeah, one has more syllables.
Exactly. So what happens is there's a lot of overlap between the two, but there's also a few differences. The main difference I like to point out to kind of simplify it for patients is ophthalmology. They lean a little bit more towards the surgical side of things. So to do something like cataract surgery, that's outside of my jurisdiction. So that's kind of more so.
So
what my
you
dad does.
can't do surgery?
That's correct. I'm not a surgeon per se.
Okay. So does he surgerize? Like, does he do that?
Oh, absolutely. And
He does?
fantastic terminology. Surgery.
Thank you,
That's
thank you.
actually what the doctor said.
Okay.
So yeah,
he does that though.
Yep, he does cataract surgery. He does comprehensive eye exams. It's mostly what he does. But every other week he does about 10 cases of cataract surgery.
Did you choose eye stuff because of him? Or like, could you have just gone to like feet things?
So crazy Paul, just going straight to feet
I
things.
don't know.
So the answer is kind of yes and no. Because of him, my earliest exposure in healthcare was eyes.
Okay,
And I was
yeah,
always
yeah.
fascinated by that. When I was in high school, I kind of decided to start to test the playing field as far as other fields of healthcare goes. I worked with a doctor in internal medicine. I worked with an orthopedist for a little bit.
Isn't orthopedist the feet?
Bones.
Shit. What's the feet one then?
Podiatry, baby.
Oh, son of a. Okay, keep going.
That being said, so I tested all these other fields, and at the end of the day, I liked eyes by far the most. Now, whether that's because it was my earliest exposure through my dad or genuinely what I liked the most, who who knows at this point, but it is what I like the most. So I kind of stuck with it.
Got it. Okay.
Yeah.
Okay. So then you, where'd you do your undergrad?
So I did my undergrad at Hunter College in Manhattan. It's on the Upper East Side.
I have no idea. I want to go to, I've never been.
Fair enough.
Yeah.
When it came to choosing my undergrad, I was never someone who wanted to go to this like massive school or anything like that, because my goal was always to get to grad school. So that's how I ended up at Hunter College, and it was a good education.
Then did you immediately go to Arizona? Because were you able to choose dry eye and then you found out about Epstein?
So skipping a step, as far as I went to optometry school. I was in
sorry.
Boston. No, you're good.
Oh.
So after undergrad, I have my bachelor's degree, but to become an eye doctor, you still need your graduate degree. And for me, that's I'm a doctor of optometry, or OD.
Okay.
So I went to Boston for 4 years, and in your fourth year of optometry school, you do these things called rotations. So over the course of a year,
Does every type of doctor do rotations then?
more or less, yeah.
Okay, all right, keep going.
It's basically an in-between. The first 3 years of optometry school, there's a lot of emphasis on taking your classes, learning everything you need to learn. And then towards the end of school, for us, it's the fourth year, you solely focus on clinical experience. So this is where you're still a student, but you're in a clinic or a practice and you're seeing patients, but under the supervision of your attending doctor.
Okay.
So that's kind of that in-between area where you learn how to be a doctor and things like that.
Okay.
So when I was doing my rotations in my fourth year, my first one was here in Arizona.
And
so
that's
that's when
where-
I met Dr. Epstein. That's when I met you guys, actually.
Now, let's be very transparent and clear about who Dr. Epstein is because of the whole thing. Can you just elaborate so that way no one gets confused in the comments?
Yeah. So Arthur Epstein. He was my mentor. He was world renowned in his kind of stature as a dry eye doctor. And
He was famous, right?
everybody knew him. Everyone within eye care knew him. Everyone, all dry eye patients around the world will know him. When I think it was like 2020 or 2021, Newsweek put out this list of like the top 150 doctors or eye doctors across the country. And the first year that list came out, he was number one, like big deal guy. And it just so happened that he and I were both from New York. He was from the Bronx. And so I came and I joined his practice as a student for 3 months. Story has a little bit of a sad ending there. Unfortunately, Dr. Epstein, he passed away about August, September of 2022.
Yeah.
So I was with him for the 3 months before that, kind of soaking up everything I can as far as dry eye goes.
And he was very, I say famous, but like he was incredibly intelligent in the sphere of dry eye, right?
Everyone, he set the standard for dry eye for a lot of people. A lot of doctors do what they do within the space of dry eye, specifically because of what he said he does. So he really
Push,
kind of paved
if
the
you
way.
hear it, like it cuts out a little bit, push the mic out a little bit, just so that way, yeah, there you go. Yeah. So go back to, he set the stage. So like people went to him, like people from all over the world, right?
Yep.
And then you, like it seems like you had you were, I don't want to say like the luckiest person ever, because then there's Lappin, and then we can talk about him. We love you, Lappin, but we're going to talk about you. It feels like you were like one of the luckiest people, because correct me if just tell me.
Yeah.
How many people did he like actually teach? Because I feel like I could be wrong.
Yeah.
But I feel like he didn't teach a whole lot of people. He trained everybody, but he didn't teach or mentor people.
Yeah. So there was a handful of students, and a handful is probably even a little bit of an over exaggeration. There was a student here or there that he took from other schools. I know he had a student from the optometry school in Waterloo, Canada, who trained with him for, again, similarly, like 3 months. This was more than 5 years ago, I think. I think there were like less than 3 or 4 students that he's had in the past. And then they took a break from that for a while. And they hired our good friend, Corey Lappin.
Corey.
We love Corey.
Yeah.
He's another doctor in the dry eye space. He worked at my former practice, Phoenix Eye Care, alongside me when I was there as a student and as a doctor. And he ultimately moved back home to Ohio with his now fiance. Congratulations, Corey.
Yes, congratulations.
So other than this group of maybe like 2 to 3 students, and then Corey, I was kind of his return to form as far as training someone to kind of continue what he's been doing. So I was actually the first student from my school who went to this rotation. This was the first year it was offered. And I just happened to be the first of 4 students who was sent to this practice.
Got it. Okay. So you're I don't want to say the student, but like you start there. You don't start there. You started all the way a long time ago, but you're there, you learn, and then so talk to me about like now you have your own practice.
Yes.
Is that what it's called? Practice?
It's a practice, yes.
But why did you jump to a practice? Like, is that what you wanted to do? Okay, so because you wanted to expand on what you were doing with dry eye, right?
Yeah, no, absolutely. So rewind a little bit, talking back about my father and his practice and everything like that. He always owned his practice. I shouldn't say always, but for pretty much my entire life, if not my entire life, he owned his own practice. And that's what I grew up with. And I saw both the healthcare side of it, but also the business side of it, because that's what he would do. And both parts fascinated me. And I really wanted to dive into both parts of that. So from an early stage after I graduated from school, I knew I wanted to take a path that would lead me towards owning my own practice. So that way I can treat my patients, but I can also set up a system that allows me to do that in the best and most efficient way possible. I didn't want to be held back by anything. I didn't want to be held back by the regulations of what someone else was deciding for how I practice. So that's why I ended up taking that pathway, and joining this practice was a very efficient way to do so in a legendary practice.
Yeah. Okay.
Yeah.
So now, I that's actually perfect. I a couple things. One, you have siblings, right?
Yes, I'm the youngest of 3.
Okay. I don't know why you give me like middle child,
Take it
But-
easy.
but I was contemplating because I thought you had siblings, but I didn't remember.
Yes.
Okay. So you're the youngest. What do they do?
So my older brother, Matthew, he's a lawyer. He works from home, back home in Long Island, but he works for a company out in California. And my sister is doing her residency at Harvard for radiology oncology,
Okay. What does that mean? Radiology oncology.
cancer research, and
Oh,
things
shit.
like that.
Oh, wow. That's crazy.
Yeah.
Okay. And what's the age difference?
So my brother is 5 years older than me, and my sister is 2 years older than me.
Okay. So like, oh, it's still 5 year difference, whatever.
Yep.
Okay, cool. All right. There's so many ways that I want to go. I'm like, I'm just like, I can't, I don't know whether I should do like not safe for work or like, I just want to like, cause these are like questions that I want to ask him because like, I want to know. Okay. So let's talk a little bit about, eye stuff because,
let's do it.
I'm an average person and
Above average, don't sell yourself short.
thank you. I winked and he didn't even look.
Sorry, I was thirsty.
It's fine. No, I know because never mind. Clearly, we have a good relationship, and I'm very happy to be his friend. I really am. Just so you know, like
I appreciate you.
I'm very very happy that we are friends. So, a couple things that I wanted to ask. I have notes right here.
Yeah.
Because first off, I was a little irritated about this whole thing because in the beginning, he and I didn't really talk about it. I'm so happy that we're friends, and he didn't call me about this, and so I didn't know which way I wanted to go with this podcast, but I do have those questions, and you know, fuck it, I'll just take it. All right, so you know what? Because I did this, because I usually don't do this.
Yeah.
I just go with how I feel, and then this whole thing happened, and now we're here. So I did. I had 4 jokes that I wanted to tell you and make.
Oh, God.
But Danae said that I'm not allowed to do 2 of them.
Thank you, Danae.
So we're just gonna do the last two. You look like the guy in the middle of the evolutionary chart. Oh, never mind. That was the one that she said I couldn't say.
I did not approve that.
Oh,
one.
that was my bad. I did that
This
wrong.
is a crazy start.
Sorry. Okay. Wait, pretend I didn't say that. Okay. Okay. You look like you would have a favorite vitamin. That's
the joke, huh?
That's
Okay.
one of them. And the second one is you look like the kind of guy. Oh no, hold on. Yep, you look like the kind of guy who would find a tandem bike on Facebook Marketplace and ride it.
Today, these are the ones you did approve?
Yeah, those are the ones she approved.
You would have hated the other ones.
That's crazy because I love these two.
Okay, so can you bring up Demodex and him, please?
Our little buddy. Hey, little
Okay,
guy.
so that's as far as I know, that's the cutest little Demodex ever,
Yes.
right? Can you go back to me now? So EYE, but I,
The letter.
yeah, capitalized 3 lines underneath. I found out that I have Demodex in my eyes that poop, shit, and throw parties at night.
You forgot they also vomit.
Vomit. I forgot they vomit. So can you explain to me what this cute little thing
Yeah.
is?
My little buddy.
Because it has ruined my life in so many different ways.
Fair.
Go ahead.
Okay, so let's talk about it. Demodex blepharitis. So to break that up,
Yeah, please.
Demodex blepharitis is the condition. Demodex is the name of the mite, specifically the scientific name. There's 2 of them. There's Demodex follicularum and there's Demodex
There's 2.
brevis. Yeah. One lives in your glands, one lives in your follicles. We'll talk about that. Don't worry.
God.
And then let's go to the other half of the word, blepharitis. Blepharo just relates to your eyelids.
Okay.
Itis is inflammation. So blepharitis in general just means the eyelids are inflamed, angry, upset. Demodex blepharitis is when they're feeling that way because of these mites. That's how you simplify that.
Got it. Okay. That actually makes sense.
So these mites, I know it's almost like I do this for a living. These mites, we all have them. All of us. Sorry, audience. We all have them.
And it sucks. I just learned. I mean, not jest, but like whatever. Keep going.
So we all have these, and it's actually incredibly common to have Demodex blepharitis in and of itself. There was a study that was done where over 1,000 patients were examined, and then they went back and looked at, of these over 1,000 patients, how many of them had Demodex blepharitis? Do you want to take a guess? What percentage of patients had Demodex blepharitis? All of them,
Oh, okay.
in
Have
theory,
Demodex.
have the mites. But how many had it to enough to be classified as Demodex blepharitis?
78%.
Not too bad. It was actually 58%.
Not too bad. That's horrible.
Not too bad. More or
You're
less,
being so nice right now. Anyway, so 58%.
moral of the story, more than half of people actually just have this. And it ranges. Some people have it and they're very symptomatic and they feel it. They feel their eyes are kind of not comfortable. Some people have it and have no idea this is going on.
So the symptom thingy majiggers, right? So like,
Yes.
my eyes would get super puffy,
Okay.
and then I don't remember what the other symptoms are. What are the symptoms? Because like I feel like I got all of them.
Yeah, fair enough.
It sucked.
So they vary. Most commonly, you get like the burning sensation, irritation. Usually it gets worse as the day goes on. You could get redness of the eyelids or the eyes themselves. You could get light sensitivity. Lights can bother you a little bit. You could get vision that fluctuates. It's not usually like, oh, my vision's blurry right now, but it's kind of that feeling of, oh, my vision just doesn't feel quite right in this moment. And that can kind of come and go. Those are kind of the main symptoms.
So they can affect your vision,
Yep.
or they can cause things in your eyelid and then the thingies to then affect your vision.
It's mostly this cascade that comes out of these mites as far as how they affect our eyes. So the mites themselves, I mean, there's some studies that show they do mechanical damage. I mean, if you go back to Mite Cam, you'll see they have little claws. See those little yellow things?
Those are claws? I thought they were like the things that for like parties. Like, because I mean, it has the little hat, so I thought it was like the.
I mean, like a party favor?
Yeah,
Like,
yeah,
blow it, it
yeah.
goes,
That's literally what I thought. So it has claws.
That would be so cute.
I don't know.
So they could cause these microscopic abrasions. But honestly, the most, or I shouldn't say the most, but the most common damage that can come from these is less so from the mite itself and more so from the bacteria it's covered with. And sorry, this is a little gross. They're filled with bacteria too.
Like poop.
Not poop, but bacteria.
Bacteria.
Yeah.
Okay.
They're just covered and filled with it. They're these little bacteria bombs that sit on our eyelids. And it'll cause so many different problems. So for example, I actually had a patient this past week. A lot of people are familiar with what a stye is when your eyelid
we're gonna
gets
talk about that.
swollen, painful, red, tender. What that actually is a local infection, and a very common cause for that can be Demodex blepharitis because of all that bacteria that's just kind of in that area.
I get those, and I think that's what I'm kind of getting at. Is like I forgot a sty. I forgot that's what it's called. So I would get. I would like saying it like it never happens anymore. Like I hopefully okay. You know what? Fingers crossed. I get like these ridiculous styes.
Yeah.
And do they question because I can't remember at this point, but like do they only happen on the upper lid or can they happen on both? Is it
They
considered?
can happen on both. It's a lot easier to see on the upper lid as far as like Demodex blepharitis goes. Styes can happen upper lid, lower lid, right eye, left
Because
eye.
it's just a bacterial infection is what you're saying.
Yep.
Oh my God. Okay. So now I think I think that's kind of like I wanted to talk about like my father. Are styes Chalazians?
Oh, such a good question. Such a
Is
good
it?
question. Yeah, that was an amazing question, just so you know.
I wish I had the okay.
I know. That would be a great time to play it. So sorry, I'm gonna get like really nerdy about this.
Please, no, seriously.
So-
You're so sexy when you get nerdy. Go ahead.
Thanks, baby.
Yeah.
So a sty.
Yeah.
First and foremost, I'll get this out of the way. Another name for a sty is a hordeolum. That's what doctors usually call it. But sty is kind of the common phrase for it. So we'll keep calling it a sty.
Did you say ordeolum?
Hordeolum.
Hordeolum. Okay.
H. So it starts out as a sty. This focal infection gets red, gets tender to touch. And fun fact, it doesn't get that way because of the infection directly. The redness, the discomfort, the tenderness, that's actually from your body trying to fight off the infection. Kind of like when you twist your ankle and it gets
Swells
red,
up.
swollen. You don't have an infection there. Your body's just trying to heal
Fix it. Yeah.
Exactly. So that's why that happens. And when someone gets a sty, there's different ways to treat it. Some people will say just do warm compresses. Some people will say
That's what Danae makes me do.
do
is
a
the warm
lid
compress.
massage over it. Sometimes if it's bad enough, you could do something like an antibiotic course. And we see this all the time with patients.
What does antibiotic mean?
So antibiotic is just a type of medicine that will fight off infection.
Is it in your mouth or on the eye?
Oh my God, you're killing it with these questions.
Really?
You have no idea. You're asking like the best questions.
Oh.
Okay, let's take a small tangent here. It's a big misconception that if you have a sty, you should be taking an eye drop antibiotic. It's actually not the case. The best thing you could do is an oral antibiotic. And that confuses people. They say, but it's my eye. Why wouldn't an eye drop
Yeah,
be better?
look at me. I'm confused as hell. Go ahead.
So think of it less of an eye infection, more of a skin infection.
oh shit.
So an eye drop or a topical antibiotic is not necessarily a wrong answer. A lot of times people can prescribe that, specifically when the infection can like express out of the gland. It kind of,
Pus?
well, I wasn't going to say that, but now that we said it, sure, let's talk about that. Yes, pus.
Okay.
It can express. That topical or eye drop antibiotic acts like a protective seal.
Oh,
for
that
the
makes
eye.
sense. Okay, that makes sense.
But it doesn't quite get rid of the infection itself.
Okay.
Oral antibiotic, that's what's going to get rid of the infection itself.
Because it's a skin problem?
Yep. Yeah. But let's go back to your original amazing question because I
please.
don't want to lose sight of that.
No,
A
go
sty
ahead.
versus chalazion. So you have the sty.
I'm sorry, hold on. A Chalazian?
Oh, this is another hot topic. Depends on where you went to optometry school, if you'll call it a
New York
chalazion
or
or a
California?
chalazion.
What?
Yeah. So
Chalazion?
Chalazion, I've heard both ways.
Oh my God, tell me all of this.
Chalazion through and through. Go team CH where it's ch.
Yeah, go Team CH.
So anyway, you get rid of the sty, you get rid of the infection.
Okay.
And what can happen sometimes as that infection's going on is some material can kind of collect in the glands and in the skin where that infection was. So sometimes that material lingers. The infection's gone, the fight is over, there's no infection there. It's not red or it doesn't hurt anymore, but there's still this bump that's left behind.
Okay.
It's not infected, it's not really causing any issues, it's just kind of there. In fact, I had a patient either yesterday or the day before with this. And that bump is then called a chalazion.
Really?
It's a sty where there's no more active infection there.
So it's like a volcano that just like is dormant.
Kind of. Yeah.
That's so funny. Okay, so the reason why I bring this up is because I thought for the longest time it was a sty. And then my father, whenever he would, clearly I'm only learning about this now. I'm 31 years old and I was watching him have this problem his entire life of that I was aware of. I don't know. And they would take a knife and they would cut it. And I didn't want to look at that part, but I don't know if they scooped it, if they did it. I feel like that was wrong. And I don't know if that's wrong or not, but like, who am I to tell my father, who is not an eye doctor, to then tell the eye doctor that they're cutting their, so is that good or bad? Or like, is that how you fix it?
So let's talk about that. Now that you bring something like that up, this is a good time to address the audience.
Hi, audience.
Full disclaimer, none of this is medical advice. Do not take what we are saying and just run with that. If you have any questions, seek a medical professional. If you have a sty or chalazion, go see your eye doctor and see what they have to say. This is educational purposes. I just had this, like I said, I had a patient with this the other day. So the way I describe it is there's 5 ways to treat a chalazion, from the most, or I should say from the least aggressive to the most aggressive.
Okay.
Least aggressive.
It's like the,
Yeah, it's like
the fifth is like you're holding you
the
down.
The fifth one is you're yelling at it.
Yeah.
You're like, go away. So the least aggressive, we talked about this one already, warm compresses and lid massage. That is just heat to try to melt down the oil. And the lid massage is just manually trying to break up that material. Pretty simple.
Hold on real quick. So is it solid oil?
It's oil. It's a lot of oil because what actually is getting infected is your oil gland, and the oil can kind of solidify there.
Oh.
That's a majority of what's there. There's some other debris there as well. But you're just mechanically trying to break that up.
Okay. Also, I'm sorry if my face is like this the whole time. Like,
no, you're fine.
keep going. Goes number 2.
So number 2, that's going to be adding an oral antibiotic to the mix to again
Mouth
try
stuff.
to just break it down. Doxycycline is a common one. Keflex.
Doxycycline.
Yep.
I remember that one.
Attaboy.
Yeah.
Anyway, next in the middle of the road, we have something called IPL, intense pulsed light.
That one's cool.
I just saw the light bulb go off. In
Oh,
your head.
yeah.
I love it.
Yeah. Can we, after you do the 5, but yeah, can we talk about
Yeah,
that?
we could talk about that a little bit now. As well.
No, finish it.
Okay, sorry. So IPL. IPL is a light therapy that helps break up the material as well. That's where my jurisdiction ends. IPL is the most aggressive treatment that I personally can do to treat a chalazion. After that, you could do a steroid injection into the chalazion that helps decrease it and break it down. One of the downsides of that is it can change the color of the skin a little bit. It can make it a little bit lighter. So there's a little bit of a cosmetic change there. And then the most aggressive is what you were talking about, surgical intervention. The fancy name for it is incision and curettage. I love that.
Really?
Yeah, INC. And that is more or less
in curettage.
incision and curettage.
Oh, I thought it was like Latin or something.
Oh, the little device for curettage. It's so cute. It looks like a little ice cream scooper.
I think that's what
Like
I
a
saw.
microscopic one that you just take the debris out.
I think that's what I saw.
It's super cute.
I guess when I was younger, it was scary.
And again,
but it
that's
could
the
be cute
most
now.
aggressive one. I tell patients to be a little careful with that. None of these 5 are incorrect answers. It's just what's
It
right
depends
for
on
which
what's
patient.
happening right now.
Exactly. As far as the downside of something like INC or surgery, is we have those oil glands that I was talking about. That's where the infection can start. And those are actually really important to the production of our tears. So if you're going to start cutting up and going in there, you
See,
can
that's the
start
part.
to cause damage. So when I do one of the tests I do on my dry eye patients, it's called mybography, where we just take a picture of the oil glands. That's all it is. And I can see when patients have had incision and curettage. I could see where it was because
Is it like dry?
It's not dry. It's just there's a chunk of glands missing.
Oh, that's crazy.
Yeah.
So they can't make more oil in that area. Is that what you're saying?
Yeah. So let's say my hand right here was a bunch of oil glands.
Yeah.
And let's say there was a chalazion right here and they cut in, they scooped it out and everything. The picture will then look like this, where there's just no gland structure there anymore.
So you can clearly see that somebody had that incision, or not incision, but that surgery thing.
Yeah. So
And then you're like, well, now I know why it sucks right there, right?
yes,
Basically.
but there's also other things that could cause that as well. So if it's helpful if I know the history and I know
yeah,
that
that
they've
makes
had that done, I can make that connection.
Okay.
But if I see missing gland structure, I can't just assume they had surgery on it because a few different things could cause that.
Got it. Okay. Now, can we talk about IPL?
Yeah, let's talk about it, baby.
Okay, because you know what? I'm not gonna pretend like I know anything about this thing. I just know that it works really, really well. There's a bunch of different reasons why you would use it, and you have it. So go talk to
Well,
me.
before I teach you about it,
Yeah.
this might be fun.
But
I want you to try to teach me about it. What do you think? What do you think IPL is?
okay, so I think IPL is a way to I'm gonna say this wrong, but like light waves
Okay.
into the skin, so that way it can wake up or revive cells or
Can I just give you a little bit of confidence? You're kind of nailing it so far.
really.
Yeah, I just heard Danae in the background go, mm-hmm.
Really? Okay. So lightweight. Well, because like, okay, so all I know is you put it on your skin.
Yes.
Or, around like, because, and I guess what you were saying is like skin irritation is what you were saying. So like you put the pill in your mouth, you fix the skin, and then if you can't, then you cut it, whatever. But the third most serious way that you can fix chalazion, right?
Attaboy.
is IPL. And I think it's because you can heal the cells, or you can revive or rejuvenate the cells around the eyes. And I think that's why you put the metal thing in the eye, so that way like you can put it over the skin and it won't hit the eye and mess up the eye.
Okay, so you more or less nailed it. I'm going to explain this in simple terms. So
Well, put it in science terms, because I put it in simple terms.
I'm going to put it in science terms that's understandable, because
Okay,
I
thank
could
you,
do
please.
it. I could start talking about photobiomodulation and stuff like that. I
Yep,
will
you lost
not-
me.
Exactly.
Thank you.
So we're going to lock in right here.
Locked in.
So there's different ways that IPL works. First and foremost, let's address this. It's done on the skin. We can do it directly over the eyelids. And yes, we would use metal shields for that.
That's so cool. I love it. I wanted him to do it today, and he's like, no, it's okay.
So anyway, these metal shields, they're to protect the eye because it is intense pulse light. It is very, very bright. And when I perform the treatment on patients, I have to wear protective goggles myself.
That makes sense.
As far as treating over the lids, some doctors will do it every time. Some doctors will just use it when they're treating the lids. I don't do it every time because there's different ways IPL can either be used to address dryness or chalazion. So I will do on-lid treatment to treat a chalazion, but for the most part, when I'm just doing it to treat dryness or something called meibomian gland dysfunction,
Ooh, that one.
which we'll talk about, or ocular rosacea is another one.
Oh, jeez, there's a freaking fly.
He's just really interested in dry eye.
Yeah, he is.
When I do those treatments, I just use stickers over the eyes to protect the eyes. So it's done over the skin. And where you kind of nailed it was this idea of light waves that kind of activate the cells, because that's more or less in simple terms how it works. Light is energy, and that energy gets absorbed by the pigment in our skin. And that process is in part that fancy word I said, photobiomodulation. That's exactly what it is.
Okay.
It's think of like how a plant absorbs sunlight.
Yeah.
Our skin.
Photosynthesis, right?
Boy. I mean, we're not quite doing that, but similar.
We're not plants.
So we have those oil glands, those little ribbons in our eyelids, and they use something, if you remember from like high school biology, the mitochondria.
It is the powerhouse of the cell.
Attaboy. Anyway, so
Drink your
so the way this works is this light is absorbed by the pigments in our skin, and it kind of activates the mitochondria of the cell, and it gets it up and running. The analogy I always use is take
Dude,
those.
I am so sorry.
Oh, you're good. It's my little buddy. We have a mic cam. We have a little fly.
And we have a
Great.
Demodex.
I love it.
He heard that we had a
Hey, buddy.
Demodex.
So we have these oil glands, and the analogy I always use is I like to pretend they're little chefs that live in our eyelids
What?
because they're making oil.
Oh,
So they're constantly in our eyelids cooking, and the main thing they make is this oil for our tears.
Okay.
And when I describe IPL to patients, I talk to them about this analogy of them being chefs. And I'd say, now imagine those chefs ran on batteries. IPL is a device that charges up the battery and gets those chefs up and running even better.
That's really smart.
That is more or less how IPL works to address meibomian gland dysfunction. Meibomian glands is a fancy word for the oil glands of our eyelids. Another thing it does a little bit on the side, I used this term earlier. It's called ocular rosacea.
Yes.
A lot of people are familiar with facial rosacea.
Yeah.
Rosy cheeks, red bulbous nose. You could get it in your eyelids too. It's actually very common where you have just these inflammatory blood vessels on the eyelids. And IPL can help shrink those down as well.
Wait, hold on, pause.
Yes.
This has nothing to do with it, but you said bulbous. Is that why they named it Bulbasaur? Is that
So a bulb
Is that what it is?
is something round, like a plant bulb. He's got the little sprout on his
Oh
back.
my God.
Yeah.
That makes so much sense now.
I'm so happy I was here for this moment for you.
Wow. Literally blew my mind right now. Bulbous. So wait, does your nose get bulbous?
Yeah. you
Bulbous
get
stick?
kind of like that roundish, reddish nose.
Holy shit. Okay, sorry. Keep going.
No, you're good.
Wow.
So that's more or less the different ways that IPL works to address dry eye. It's a great treatment.
I
do
wish I
it
had
every
like a
single
side
day.
by side. Maybe actually, can you send me a side by side so that way I could literally put it right here?
Yeah.
Because how many treatments does somebody do so that way they can like, because it dramatically changes you.
It's really helpful. And it's actually kind of this hot topic among doctors because you'll see doctors, they'll go out, they'll get this fancy IPL machine, they'll do it, and they'll be like, it's not working. My patients aren't happy with it. And a lot of times that can be because sometimes you got to find the right patients that are a fit for a treatment like IPL. So if you just try to do it on everyone, you're going to end up with patients who don't really benefit from it. But for the patients where you use it correctly to address their concerns, it works tremendously.
Can I ask you, because I think something, oh my God. So IPL.
Yeah.
Am I correct or am I incorrect that like if you have more melanin, then it hurts?
Yeah. So it's, again, a little bit counterintuitive for patients sometimes. They get a little bit confused by this
Okay.
because you would think, just if you're thinking about the process of how IPL works, you would think someone who has darker skin, you might need more energy because
Yeah.
the light might not get absorbed. It's the opposite.
What?
So the pigment in our skin, like melanin,
Yeah.
that is what absorbs the energy, like a lightning rod. So if you have more of it, you have more lightning rods.
Really?
So if I pull the trigger on IPL, more is going to get absorbed, and it's a lot easier to cause burns to a patient who has darker skin. There's this thing called the Fitzpatrick scale.
Yeah.
It goes, I think, from 1 to 6, and above like a 4 or a 5, you can't even really do IPL. So
Really?
Fitzpatrick of 1, think of the palest person you can imagine. Fitzpatrick of 6, opposite end of the spectrum.
Yeah.
So the
The darkest skin is the
higher Fitzpatrick number.
Fitzpatrick.
Yes.
Okay. So good.
So when we do IPL on someone who has darker skin, we actually have to turn down the
machine.
settings because they're so sensitive to it. You use less energy, and the skin could actually absorb it just as well as if you use more energy on someone who is lighter skinned.
Damn.
And there are some people where the skin is actually too dark for even us to even consider IPL because
Really?
it would just burn their
Burn.
skin.
Oh wow.
Yep.
Holy shit.
Yeah.
Literally mind blown in like a couple different ways. All right, we're gonna have to do this again
Yeah. let's do
because
it.
I have a lot more questions, and I want to get to the other thing that we're gonna do today.
Yeah.
I have some rapid fire questions just
Bring
to
it on.
end this
Yeah.
because I have so many freaking questions about this, and you did a really good job explaining,
I appreciate
like to a regular person like me, and I don't want to say dumb, all right, but like an average person who doesn't go to the eye doctor very often.
Fair. Let's actually talk about that for a second.
Yeah.
This will be real quick because that's actually a lot of why I do what I do and how I do it. So going back to my family a little bit, my dad, an ophthalmologist, eye doctor, that's a passion of mine. My mom's actually a retired high school chemistry teacher. And if I wasn't a doctor, I actually wanted to be a math teacher.
Oh,
So I kind of, in my job, try to find a way to be able to do both, where I am a doctor treating my patients, but I also think it's really important to educate my patients. And I think there's more to that than just throwing medical jargon or fancy words
Yeah.
at patients. I want to make sure people understand what's going on. So that's actually why I try to explain things the way I do, is so that it is in understandable terms.
yeah, and I feel like that really matters whenever there's somebody like me who like like if I do have a problem.
Yeah.
And if I'm going in there and then you throw all this science jargon at my face and I'm like, just fix it. If you're not going to tell me,
Yeah.
just fix it. And then like you put a cream on my eye and really you're supposed to give me a pill in my mouth. Anyway.
Hit me with questions, buddy.
Well, I mean, and on that note, I wrote this down. What hurt my feelings more than anything, and I've been cheated on, is I found out that I have a very low percentage in my right eye. And I believed for the longest time I was 20/20. And then I think Danae was like, I don't think so. And then so she brought me in. And then apparently like I have, is it a negative or a positive percentage? How does that even work?
So
It's-
2020. Oh, today you want to wait? I love this.
Well,
Danae,
I was
you wanna
just
explain it?
gonna clarify. It's not a negative percentage that you have. You just have a mild prescription, just a mild,
Oh, so it's called a mild prescription.
Yeah.
more or less.
Okay.
So wait, let's take a pause here because
Yeah,
this
go.
is always fun
Go,
to
go,
explain
go.
to people.
Well, are we okay on time? I just want to make sure that
We're
like,
fine on time.
Okay. Okay. Hey, dude.
So I'm going to ask you a question.
Yeah.
Because I like quizzing you here.
Yeah, let's go.
What do you think 2020 means?
Perfect.
Okay. Why 20?
Why 20? Because I was told 20.
Yeah, but like,
if it was zero,
why
then
does-
I would say zero.
why
Zero,
does
zero.
2020 mean perfect vision? Do you have any idea where the number 20 comes from?
To be honest, I mean, I
Yeah, most
don't.
people don't.
No.
So it's
Is
actually,
it on the? No, never mind. I'll shut up.
it's
Go.
a measurement of distance. It's 20 feet. It's
What?
20 feet over
That's-
20 feet.
What?
So no, yeah, this is something people usually do not understand. So 2020
Yeah,
is this idea of perfect vision. I'm going to blow your mind a little bit.
you already have. So
Oh, just wait.
keep blowing.
Here's the mic drop. You could have vision that's better than 2020.
What?
Yeah.
What? 1010?
No, the first number is always 20, and
Oh.
I'll explain why.
Okay.
So my vision is actually 2010 and 2010 instead of
Wait.
2020.
So it's a fraction?
Kind of. So let's explain this. The first number is always 20, and it's 20 feet. And it's the standard that was set. So if you think of the eye chart, imagine it's 20 feet away, and you're
Is that
looking.
why you do that?
Yeah.
Okay. keep
That's
going,
why
sorry.
there's the distance at which you look at an eye chart is set. It's predetermined.
Oh, so
You
does
can't
the
just
room
go anywhere.
Does the room like you put you in your new practice like where you put it? You have to be at a certain distance to like do that test.
Yes, and if you can't do the full 20 feet, you have to scale down the vision chart.
Oh shit.
Yes. So the first number is always 20.
Okay.
This and 2020 is just this arbitrary standard that we set for this idea of perfect vision.
Sure.
So let's say someone is 2050.
Okay.
That means their vision is worse than 2020. But what those numbers actually mean
Yeah.
is if there were letters in front of you,
Mhm.
if you could read them from 20 feet away, Someone who has 20/20 vision can read them from 50 feet away. So they're even further back, but they can see it because their vision is better than yours. So it's all kind of this arbitrary scale, and the numbers are just distance. The first number is always 20. That is the standard. The second number.
So they're basing
dictates-
what the second one, the second one is dictated by the first one.
Well, the first one's always 20. No
Okay,
matter
sorry.
what.
Whatever.
The second one is dictated by how good or bad your vision is. The higher the number, the second number is, the worse your vision is.
So it's not 20/20, it's 20 something and the 20 something?
Yeah, it's 20/20 and 20/20.
Wow.
Yeah. So
Okay, yeah, I guess you blew my mind again.
a good way to simplify this. We all know the big E on the vision chart. It's the biggest letter.
Oh,
It's like the
okay.
classic
Yeah.
big E on the chart.
Literally, sorry. Whenever you were saying that, like I read the book The E Myth. I don't know if you've ever read it before, but it's got a huge ass E on the book, and so that's what came to my mind. So the big E is the E Myth. Read it; it's a great book. Whatever. I'll shut up. Go ahead. Keep.
So the big E, which most people are familiar with on the vision chart, it's the letter at the top or the biggest one. That's 2,400 on the scale.
Oh! I fucking get it now.
So that's why that E is so big.
400 is like at 400 feet away. You should be able to see that.
So if I'm 20/20
yeah.
and the big E is on the chart, I could stand 400 feet away and I could still see that it's an E.
Isn't that what I just said?
Someone who's 2,400,
Yeah.
they can only see it from 20 feet away.
That makes
If they step back further, they can't see it anymore.
Damn.
Yeah, so that's how that works. I know. You didn't expect the first question to blow this door open, did you?
No, that was crazy. Because like then like like whenever you're like starting your practice, you have to like I'm just assuming as a business owner and also an not ophthalmologist, an optometrist.
Yes.
You have to like look at the layout of your place and you have to figure out how far of a distance you need to have the patient so that way they can look at the thing. And then you have to buy the right thing for the right distance.
Yeah. And in fact, if some people are watching this and they're like, but when I go, I look at a mirror and I see the screen is behind me, that's them trying to create 20 feet. So if you have a room that's 10 feet,
Oh, and there's, oh my
they'll
God.
put the screen behind you because then that 10 feet becomes 20 feet.
Wow.
Yeah. Yeah.
Holy shit.
It's cool stuff.
That's really smart.
Yeah.
Wow. I'm glad you're doing this.
I got you.
Like this and being a doctor.
Yeah.
Like, okay. So, so I edit all day and my eyes burn really bad when I close my eyes. Why is that? I don't understand.
You're asking questions that I could spend hours talking about.
So that's what I asked you if you're okay with time.
I am.
Okay.
Let's talk about, there's more to this, but let's talk about it in simple terms.
Okay.
There could be a number of things going on. The most likely culprit is you're not blinking enough, as in the number of blinks, and you're probably not blinking well enough. So
Excuse me?
I'm gonna explain this very concisely.
Okay.
The
I'm
average-
not blinking well enough.
It's not just well enough, just the amount enough too.
You're not doing a good enough job, is what he's saying.
Twice. Anyway, so I love that I could hear Danae cackling in the other room. It's my favorite thing.
It was freaking funny.
So let's talk about the number of blinks first. And again, this is going to be concise. The average person blinks 16 times every minute. Just
Okay.
up and down.
Now that I'm thinking about it.
Exactly.
Okay.
If you are doing anything where you're focusing,
Uh-huh.
looking at a phone, a computer, reading a book or a newspaper, watching TV, instead of blinking 16 times a minute, your blinks can drop down to as low as 4 times a minute.
Really?
Yep. So you're only blinking about 1/4 as much. So that's one part of it.
Okay.
The other part of it is the quality of the blink.
That's really fucking funny.
When we blink, you want the eyelids to come all the way together and touch and then come all the way apart. A lot of people, when
Really?
we're seeing this a lot, and we'll talk about this more eventually, with increased screen usage, we're seeing these things called partial blinks, where you
mean
only blink
like
about
phone?
halfway down.
Phone and computer.
Exactly. But even something as simple as reading a book. I try not to blame screens too much, but yeah, anything where we're focusing up close.
Oh.
Our brain hates blinking. because you're taking away vision. It hates it. Absolutely hates
That's
it.
really funny.
So it tries to cheat our blinks by making them faster and shorter and less often.
Okay.
Because if you try to read a blink, if you try to read a book and you are just blinking the whole time, your brain says, I can't read the book. Let's blink less.
Yeah.
But it ultimately leads to the eyes getting red, irritated, that burning sensation. Eye doctors have this thing called the 20-20-20 rule. Has nothing to do with 2020 as far as vision goes.
It's like the other fraction
it's
of
the other one.
It's like 2020, 2020, and 2020. I'm like, oh shit.
So this rule of thumb is for people like you. Spend hours behind a screen.
People like me.
Yeah, exactly. I said what I said. You spend hours behind a screen, like editing and working and stuff like that. The rule of thumb says every 20 minutes, you want to look at least 20 feet away for 20 seconds.
Really?
And what that means is that every now and then you're taking a break from having your entire world be right in front
From
of
the
your face.
focal point being right here.
Exactly. You're giving your eyes a 20-second rest every 20 minutes. That's what that means.
Oh, that's really smart. Danae never told me that.
I would
I
like
hope
to
she
set
said that
the
on
record
mic.
straight. I did. I
Did
just
you
didn't
ever say
call
2020?
it- No, because I knew it wouldn't stick in your brain.
You said, Joshua, turn the fuck around and look at the wall. Or no, I don't know what. No, she never,
I
she
just
wouldn't say
said take your eyes off the screen and do the blinks that I told you how to do.
She did tell me to blink, and this is what she told me to do.
Yeah, good squeezes.
That's good.
Yeah,
Yep.
we could
That
talk.
hurt.
I'm telling you, I could spend hours talking about why blinking is important.
Well, that would be like, and I want to talk about that. So we're just let's
We'll do. Let's put it
You
this
see
way.
what I'm saying?
Like we'll do this
I
again.
really like this.
And I think for people who are watching, if they have questions, they can find
Yes.
ways to send you questions. And next time we do this, we could address some of those questions. So
Yes. Okay. Let's keep going because again, I could keep you.
let's do it.
Well, I mean, I think this goes right into it. Do you think dry eye is a result of technology? And I think you kind of just
Yes and no. I think it's something that has existed for a long time. It will continue to exist for a long time. I think technology can exacerbate it, but
I love that
let's
word.
put a little twist on it. There is a lot of technology that's helping improve dry eye as well. So I don't think technology is necessarily a bad guy. Things like IPL. IPL's technology.
That is technology. Okay, yeah.
It's helping improve dry eye.
You are correct. I should have been more specific.
Yeah, that's all right.
We will be more specific next time. Okay, next one. I'm gonna say this so wrong, but like, what is the sexually transmitted disease word that sounds like a sexually transmitted disease that you get in your eye? What is Danae? Can you help me out here? Because like, there's like this thing that it sounds
Are
like.
you talking about herpes?
Yeah, herpes, herpetic carrot. Yeah, that one.
Herpetic. Close.
Please, please.
You nailed it. So there's actually a lot of different things you could get in the eyes. You can get chlamydia in the
You
eyes.
can get chlamydia in the eyes.
You could get gonorrhea in the eyes.
No, you can't.
You sure
Oh,
can.
I thought I was just doing that because it sounded like a sexually transmitted disease, and I wanted Danae to help me like figure it out. She did, and now you're telling me there's actually sexually transmitted disease that you can put in your eyes.
Can I tell you a really fun fact about
Please.
chlamydia in the eyes?
Yes.
This is a really fun fact.
I'm so here for this.
There is a more likely chance if someone has chlamydia in the eyes.
That they
That it-
got the chlamydia. No, I'm just kidding. Keep going.
Well, yes. However, it's more likely that it's in the right eye than the left eye.
what?
Yeah.
Why
And
is that a thing?
because more people are right-handed, and the way it gets transferred to the eye is from people who are not very careful with their hands and transfer it from location A to the eyes.
Oh, that's fucking crazy.
And so it's more commonly found in the right eye than the left eye because more people are right-handed.
That's so funny.
Yeah.
Oh my god.
It's one of my favorite like fun facts.
That's
still.
really yeah. I mean,
it kills at parties.
you're like, let me tell you something. All right. Last round. Okay. Did you ever play any video games?
Oh yeah, all the time.
What kinds? Yeah, just tell me.
Quick disclaimer: I'm awful at them.
Okay, that's fine.
So the background here
I
is
was
a
not
little
going to play with you.
my friends live all across the country, so it's actually the way we all keep in touch.
Oh,
We
that's
play
cool.
video games together every now and then. The list goes on and on. It's usually whatever phase we're in at a given time. There's a
What are the
game-
top two?
right now, we're playing this game a lot called Lethal Company. It's
Okay.
where you're each this character that has to go into this scary space and try and just collect items. but there's also monsters. The cool thing about this game is they have this thing called proximity chat.
Okay.
What this means is
It 20 feet proximity?
it actually kind of in the game, if your characters are close to each other, you can talk over the mic and headset. But if you get too far from each other, you can't hear each other.
No way.
So if someone gets lost, you like can't hear them as well.
Oh, that's
So I'll hear
creepy.
my buddy like screaming
But
from like,
so light.
but so faint.
Oh, that's so creepy.
Or if you get captured by a monster,
Yeah.
it just cuts your mic. So you're like,
So you're dead.
and then it just cuts off. And I'm like,
do you
oh,
like
there goes
respawn
Justin.
too, or do you just can't come back?
Like
for
in
that particular-
that specific game, you cannot come back. This is a little bit morbid. One of the parts of the game is if a monster gets you, your body is still there, but like your mic is cut off, and you just
So you're
can't,
just
like-
watching.
so part of it
you watch?
is in the game. You start off on this like spaceship, you go out, you explore, and then you have to get back in a certain amount of time.
Yeah.
But for the people who don't quite make it, you want to try to bring their bodies back because otherwise there's a penalty.
Oh my god!
So like
you
if
have
you know,
to bring them back.
yeah, so you gotta like find their
Jesus
body somewhere if you know they're there. Or like I'll be talking to someone and then like I'll ask them a question and you won't hear it. I'm like, are they just too far away or
Are they
the monster-
dead?
Yeah,
Oh.
it's a great game.
That's crazy. Okay.
Yeah.
Next one. Why did you tell my girlfriend you couldn't date somebody like me?
Like you.
Mhm.
The sexual tension, obviously.
Okay. All right. Cool. Next question. Are you a middle child? Already did that one.
How dare you?
Have you ever run a marathon?
No, God, look at
No.
me. No.
Oh, have you ever run a half marathon?
No, I've run a 5K once.
So, have you ever run a quarter marathon? Is that a 5K?
No, a quarter marathon would be about 6.5 miles. So no.
Okay.
5K is 3 miles.
Okay. If your dog could talk, would his voice sound like Morgan Freeman or Owen Wilson?
Oh, good question. Honestly, if he could talk, I don't really think he'd say much. He's a pretty quiet guy. He's really chill.
But when he does talk, would it be Morgan Freeman or I believe is Owen Wilson?
yeah.
Yeah.
Wow.
Yeah.
guy.
Oh wow, that was really good.
Wow. I would go more Morgan Freeman.
Okay. Oh, he's black. Okay, cool.
Yeah.
Do you like tandem bikes?
Tandem bikes, that's front and back, right?
Yeah.
So I'm thinking also like tandem motorcycle where it's like side to side.
Oh,
I don't
okay.
think of bicycles like that. I guess that doesn't really work.
Yeah, that wouldn't work.
I've biked pretty much my whole life. I go mountain
Really?
biking all the time. Yeah.
Oh, I was
I've
joking when I said this. And then
I've
apparently-
never been on a tandem bike though.
No.
Can't even imagine how that would work.
Pedaling. Okay.
Thanks. man.
I thought you said you were going to take me snowboarding. What happened with that?
Day's not over, bud.
Okay. Do you get seasick? And if you do, how seasick do you get?
No, actually, no. Most of my family gets seasick. We went on a family cruise like 15 years ago or so. My dad gets very seasick, but nope, not at all.
Last question,
Bring
and
it
then we can end this. What's your favorite sandwich? And don't tell me the ingredients.
Don't tell you the ingredients.
Yeah, like it's not. It can't be the name of the sandwich is the ingredients.
How do I tell you my favorite sandwich is a chicken parm without telling you?
He already messed up. All right, well. Honestly, this was amazing,
I loved
and if you can, I would love to have you again.
Let's do it.
So I can ask you way more questions. Okay, well, my name is Joshua. This is the Baby J Show. I am very grateful. The last thing I want you to do is look into the camera and tell them first and last name. Please spell the last name, and then at where they can find you.
Yeah. So first name Andrew, last name Zagelbaum. That's Zagelbaum.
That was sexy.
Socials, you could find me. Dry Eye Center of Arizona. It's the name of my practice. We have an Instagram. We're actually working on potentially making a YouTube because of something we're going to film a little bit later. But that's where you guys can find me. Yeah.
Honestly, thank you so much.
Thanks for having me.
This has been the Baby J Show. Love you guys. Talk to you soon. Okay, bye.